Hello, good morning everyone. I'm Lexi, ED nurse by day, sewer, and history nerd by night. So today, I thought I'd react to one of my favourite medical dramas, Scrubs. Scrubs is a hilarious medical drama, one of my favourites. Not the most accurate when it comes to medicine, but it's just the best medical drama out there. So, let's get to it.
I'm the man.
My god, I wish I was this confident on my first day. I was a wreck of nerves.
And 4 years of pre-med, 4 years of med school, and tons of unpaid loans have made me realize one thing.
Good. Could you go drop an NG tube on the patient in 234 and call the attending if the lavage is positive?
I don't know Jack. I can't.
Oh, poor JD. At least let the man walk in. He's not even put his stuff in the staff room yet. I'm telling you, if someone did that to me, I would tell them to go away. I need at least half an hour because I'm one of those weird people. I come in half an hour before my shift starts because I need to sit down, have a cup of tea, and mentally comprehend the fact that I now have to work. But poor JD, like this nurse doesn't even know who JD is because he's just started his first shift. So at least give the man a chance.
So this is my story. I'm supposed to be up in intensive care.
Good, we just turfed him there.
Look, I became a doctor because I wanted to help people. But orientation yesterday, it didn't really focus on patient care.
The hospital doesn't want to be sued.
Yeah?
Being sued is not a good thing.
Focus on the lawsuits. That's all that matters. I don't know what orientation is like in the US, because obviously I'm in the UK, but my orientation lasted a week. You have to go through about how the hospital works, getting all your paperwork sorted out, so much paperwork, getting your IT access, getting all your cards, being shown around. It's so boring.
Doctors, if there
I'll
is a
call it
mistake,
surgery, no.
don't admit it to the patient. Of course, if the patient is deceased, and you're sure, you can feel free to tell him or her anything.
Okay. In the UK, again, I can only speak from the UK experience. When we make a mistake, we cannot hide it from the patient. It's called duty of candor. It's actually best to admit your mistake to the patient. So if you make a mistake, what you're legally bound to do, you have to admit your mistake to the patient, apologise profusely, then explain how you're best going to rectify that mistake. So let's say, for example, I've gone up to the patient and I've given them codeine, but I've not read their drug chart and they've already had codeine at 8 o'clock and it's now 9 o'clock and I've given them more codeine. So technically, they've now been overdosed on codeine. So I then go back to the patients, let's say they're Mr. Smith, and I go, Mr. Smith, I would like to sincerely apologise, but I'm afraid you've been double dosed on codeine. So I apologise, I explain what's happened, I explain why the drug error has happened, and I explain what we're going to do about it. So we're going to get a doctor to see him, we made to take bloods, do extra observations, explain what could happen post double dose, etc, etc. But it's always best to admit your mistake and how you're going to rectify it. Then obviously document in the notes what's happened, do a day text, which is what we do to report any incidents or accidents that have happened. And if the patient does wish to sue, then that's the patient's right. Or if they wish to make a complaint, that's also the patient's right. But you should not hide mistakes from patients. We don't do that here.
Great. 1, I am your resident, Dr. Jeffrey Stedman. Not Jeff. 2, here are your manuals. This is a
You ever notice how quickly some people make an impression?
Just
I'm a tool.
Going along on our own in
I'm a
wheelchair.
tool, an unbelievably annoying tool. Yeah, finally.
I love this
These
show.
are your beepers. From now on, they control your entire life. Okay, thanks. Move it.
Back.
Yes, we still use beepers, and they're annoying. But what they do here, a doctor wouldn't get their own personal beeper. You get a beeper based on what your role is. So if you're the medical reg gets a beeper. So they'll be assigned a beeper for the medical reg for that day. So the medical reg beeper will always be the same number. So it'll be 1, 2, 3. So the medical reg assigned for that day will have the beeper for 1, 2, 3. And the medical SHO will have 3, 4, 5, or whatever. And the surgical doctor will have 1. So there's a specific beeper for a specific role. And they're so irritating, so you got to beep a doctor. But they are great for communication, because you beep a doctor and they ring you back. You don't have to go looking for them. You just beep them and they magically ring you back. It's great, and they're very effective tools to use.
How's Paige?
Oh, first day, Bambi.
Yeah.
Carla will take care of you. Don't look at me when we're moving somewhere.
Why?
We're waiting for Dr. Cutts.
Hi, Doctor. I'm...
Place an IV for me.
We'll talk later.
Carla, can I ask you a personal question?
I
do
do
you
like
spray
Dr.
the
Cox.
perfume on, or you
Bit
just
of an
fill your
ass,
bathtub up with it at home
but I
and
do
splash
love
around
him.
in it?
That smells nice.
Come on. You've
I
done this
got
to
well,
cadavers
Dr.
before,
Cox.
so
We
this guy's
have
alive.
good
Just
bad
poke it through his
men.
skin. Poke it through. Now!
I'd take none of this crap.
Time's up. Carla, would you do it for him, please? I'm also going to need an ABG.
Why are you telling her?
Shut up and watch.
Be nice to Bambi.
Why has this Gomer got to try and die every day during my lunch?
It's a little insensitive.
You tell him, JD. You tell
Ben's
him.
92 years old. He has full dementia. He doesn't even know we're here. He is inches from Carla's rack, and he hasn't even flinched.
Oh, that is so sweet.
Yeah, it is.
What about his subconscious?
Eisenhower was a sissy. I think by the grace of God, we're going to
I
be
love
okay.
this show.
Oh, and from now on, whenever I'm in the room, you're definitely not allowed to talk.
So an ABG is an arterial blood gas. It can give you a lot of information about the patient's condition, and you get a lot of results such as blood glucose, level of lactic acid in the blood, the pH of the blood. It basically gives you a good indication of how well the patient is. It gives you a level of oxygen in the blood, so if their breathing is efficient, CO2. It's a very good way to indicate of how well or how unwell the patient is. So it's a very good tool for doctors to use and for how well the patient is. So I love ABGs, or a VBG, a venous blood gas. But they're very good tools to use. So you know how well your patient is, especially if they're septic.
Dorian, can you tell me what ailment most often
I think I'm gonna love rounds. It's like being on a game show. What is uremia?
That's my boy. And hey, nice clean job on the Foley catheter.
I had a nurse do it. Unfortunately, I'm still afraid to touch it.
I love the glare.
I've been thinking a lot about Elliot.
A whole lot.
Dr. Reed, you're late.
I got puked on.
You're off the hook if you can tell me what to look for in a uremic patient.
Anyway, I'm going for it.
Infection?
That's my girl. Moving on.
I've never really worked on the wards before. I've only ever done ITU and ED, so I don't know how accurate this is for the rounds. They don't really do rounds in ED. But it seems a bit mean to put doctors on the spot, especially the baby doctors, you know. They're just new. Need to nourish the baby doctors, you know, help them out a little bit. And I love how they wanted JD to put the Foley catheter in. Doctors don't put catheters in patients. They need to practice. I've had a lot of baby doctors, they have to have skills they have to do when they first start and to practice, but doctors generally don't put catheters in. That's what the nurses do. Same when JD had to wanted to put a line into the patient. Doctors don't do that. That's generally a nurse's job. So I think it's quite fun when Dr. Cox is like, put a line in for me. Yeah, doctors don't generally do that. That's a nurse's job. But this is quite funny. Oh, and thankfully, touch wood, in 10 years of nursing, I've never been puked on. I've always managed to avoid it. You've got to be quick on your feet. I've had blood on me. I've almost been pissed on. I've never been pooed on. I've been farted on a few times, but I've never been puked on.
Well, this calls for a celebration. I will.
Did you actually just page me to find out how much Tylenol to give to Mrs. Lenzner?
I was worried that it could exacerbate the patient's...
It's regular strength Tylenol. Here's what you do. Get her to open her mouth, take a handful, and throw it at her. Whatever sticks, that's the correct dosage. And under no circumstances are you to compromise our no talking agreement.
Dr.
He could
Kelso,
be
he's
more
always telling me, you
supportive.
gotta stay positive.
I'm gonna go ahead and say this
He's
just
a
as
baby
carefully as
doctor. Be
possible
nice
so
to
I
him.
don't overstate it. Dr. Kelso is the most evil human being on the planet and may in fact be Satan himself.
It's just that this isn't really what I expected, you know. Most of my patients are, older and sort of checked out
Yeah.
mentally.
Pumpkin. That's modern medicine. Advances that keep people alive who should have died a long time ago, back when they lost
about
what made
8%
them
of my
people. Now,
patients
your
are
job
about-
is to
are
stay
elderly.
sane enough so that when someone does come in that you actually can help, you're not so brain dead that you can't function for the love of God. What?
It's just, do we think we should be talking about them for...
Her? She's dead.
I love this show so much.
Write this down, Nubby. If you push around a stiff, nobody will ask you to do anything.
You've been like a father to me.
Fair enough. You want some real advice? If they find out the nurses are doing your procedures for you, your ass will be kicked out of here so quick it'll make your head spin.
And there it is.
Have a terrific day.
Oh dear, he's not being very supportive. When we get all the baby doctors, so in England, all the baby doctors normally come around in like August, September time. And as a nurse, it's generally our responsibility to help support the junior doctors because they don't always get the support from the senior doctors. I generally find, especially when it comes to doing procedures like cannulating, catheterizing, all the procedures that they have to learn how to do that they will never do again in the future, but they're expected to learn how to do. And they're very nervous, they're very scared, it's their first day, you know what I mean? And again, when JD's asking for advice on how to prescribe medication, he's never done it before. It's his first day, for crying out loud. You know, they're very new to this, they need help and support. So it's very common for a doctor to ask me what the dose is for medication or how to prescribe medication because they've never done it before. And I've been doing it for like 10 years, you know what I mean? So you got to support the baby doctors, you got to help them out a little bit. For the first month, you got to help them. Because, you know, they're new, they're scared. It's big responsibility being a doctor. You know, your patients' lives are in your hands, especially when you've got nurses coming at you like, "Doctor, I need this now." And they're just like, "I've never done this before." So, you know, Dr. Cox could be less of an ass here in this situation because, you know, it's a very scary situation to put on their shoulders. And can we just point out the break room here? This is completely accurate with, you know, magazines and books just everywhere being very messy. This is on par.
Like that, I was back in high school. You see, surgical interns, they're all slice them and dice them. They're the jocks. Medical interns,
We're trained to think about the body, diagnose, test.
the medical interns, well,
You got a stain.
we're the chess club.
Kind of, not really. Sometimes surgeons don't have the best bedside manner with patients because they don't spend as much time with their patients as a medical doctor. But I've met medical doctors that can be nasty, and I've met social doctors that can be lovely. So I wouldn't necessarily say this is entirely accurate. Every doctor is different, every person is different. It's not just the surgeons are nasty and the medical are nice. They're all different, you know?
Shut up and do it.
Fantastic. Now just suck out the fluid with the
Hard
giant
woman.
needle.
I think this needle's too big. I'm gonna get a nurse.
Come on, man. Learn by doing. Learn by doing.
Has he ever done that before?
Why couldn't I do that? I hated him at that moment.
Okay, maybe the needle was just a little too big.
Oh, you think?
What's going on down there? Nothing, ma'am. It's totally normal.
I think they're trying to drain ascites. So ascites is fluid that collects around the abdomen near the liver. You get a lot of chronic alcoholics that have ascites and people with failed livers, things like that. So I think that's what they're trying to do. But normally people have ascite drains already in. And I'm certain when you're meant to drain ascites, you're meant to use an ultrasound. But this is hilarious. I most certainly wouldn't spute out like a fountain. That's hilarious. Especially Turk. I'm certain Turk shouldn't be doing this unless he's been trained. And they most certainly wouldn't be doing this without a senior doctor watching them. Just saying. But that's hilarious. Especially with a patient just like reading her paper. Just chilling. People with ascites though, they come in regularly as an outpatient to have their ascites drained. So unfortunately you can't do anything about ascites. The fluid just builds up over time. Then you've got to come in and have it drained regularly. That's the only way you can treat ascites, unfortunately. But this is hilarious. I love this show so much. Run, Forrest, run!
Someone's heart fails, they beep everyone. The first doctor in has to run the room, tell everyone what to do, basically decide if the patient lives or dies. What, am I crazy?
You chicken.
Don't worry about the patient. Turk was already there, learning by doing.
Sarge!
Plus, it turns out the guy was just sleeping, attached to a faulty monitor.
Okay, first off, there'd be way more people than just 3 people in there. The surgeons wouldn't be bleeped for a cardiac arrest. So they during a cardiac arrest, you put out what we call an emergency call and you dial 2222. And the call will go something like this. They'll go, yeah, emergency. They go, cardiac arrest, ward 39, bay 1, bed 2. And they'll repeat the message. They'll bleep the cardiac arrest team, and everyone in the cardiac arrest team, they'll be bleeped, and they'll also bleep the medical reg, the consultant, and the site team. So the site team will be the who's in charge of the hospital. And they'll all come in. The most senior doctor on the team will normally take charge of the arrest. They'll stand back, and they'll assign roles to everyone. So someone will be given the role of CPR, Someone will put on monitoring, someone will get drugs, someone will time, someone will scribe. And everyone will be given a role. Someone will cannulate, etc, etc. And you do CPR for 2 minutes. Someone will get the airway, normally the anaesthetist. You'll do CPR for 2 minutes, then you stop, you analyse the rhythm, then you shock, give adrenaline, or you continue CPR depending on what rhythm they're in. But this is hilarious. So the guy was attached to a faulty monitor, so before you'd even shock them, you'd assess for signs of life. So are they breathing? Do they have a pulse? So I'm assuming he had a pulse and he was breathing, since when they shocked him, he instantly woke up. So this would have happened, but that's hilarious. Imagine you're just sleeping, next thing you know, you're being zapped awake. I mean, that's one way to get woken up in the morning. Who needs coffee or Weetabix when you can just get zapped awake? I don't blame JD or Elliot for hiding in the cupboard. But also, you'd get training for this. You wouldn't just be expected to run the arrest. You'd get advanced life support training. So you'd actually have the skills and the experience to know how to do it. So you wouldn't just lead the arrest. You could help in the arrest by doing CPR, the drugs or whatever, but you wouldn't just be expected to lead the arrest. God damn it! Sorry, my ring light went. So yeah, so you wouldn't just be expected just to lead the arrest. You'd have the proper training. And because JD is such a new foundation doctor, he wouldn't be expected to lead the arrest because he doesn't have the skills to do so, neither would Elliot. But they'd certainly help. And if you're ever in an arrest, CPR is the best thing to do because you can do the CPR and watch what's happening around you, and you can learn what to do in the arrest, and that's the easiest thing to do. And no one will expect anything from you. Just do CPR, easy peasy. It's going to be Dr. Cox's pep talk.
Worst case scenario, you kill somebody, and that hangs over your head the rest of your life. But that is the absolute worst case scenario.
You're such an ass.
Just have the nurses do all the stuff you're still too chicken to do, which I assume covers just about everything. And if you have a really rough admission...
Call you?
No, I was going to say go hide in the closet again.
Oh, Dr. Cox. But to be honest, you know, if doctors do struggle, they do call the nurses for help, and that is okay. We're all here to support each other. If you're struggling, you call for help and you escalate. So if you don't know what to do, you call for help, whether that be a senior nurse, so I'm a sister, so whether it be the senior nurse, a registrar, I'm assuming Dr. Cox is a reg, or the SHO, which would be the next one above JD and under Dr. Cox, because I'm assuming he's a reg, he seems very competent. You escalate. That's what you do as a new doctor. You escalate. If you're not certain, you escalate. Same as a nurse. If I'm not certain, I escalate to the band 7. The band 5 will escalate to me, because I'm the band 6. That is what you do in medicine. We all here, we help and we nurture and we support each other. That's what medicine is for. If you're uncertain, you always ask for help. And that's what JD is trying to do, but Dr. Cox is being an ass.
Oh, you are just the worst type of person.
Car accident, crashed in the elevator on the way up.
We gotta relieve the pressure in his chest. JD.
You got this, JD.
Oh, God, no.
You got this, JD.
You can do this.
And I believed him.
Chest tube tray.
Chest tube tray.
Kinda.
Come on, baby, let's go. Chop, chop.
You can do this. You have to do this.
JD, cut him or lose him.
Okay, give me the tube. I can't get it through the flora.
Well, don't be gentle. Get it in there.
Okay, connect it, please, Carla.
Yeah.
Normal rhythm.
No way.
Hey, it's a piece of cake. It's your patient.
You're leaving?
That's your patient, doctor.
Oh, he's trying, isn't he? Mm-hmm. And that is how you support your junior doctor.
Good. That's enough.
Sorry. It's a very big moment for me.
So I think that man had what I'm assuming is a hemothorax. That's when blood collects in the chest wall and compresses the lungs and the heart. And basically, if you don't drain it quickly, you're going to go into cardiac arrest. Normally you do a chest drain and ultrasound to figure out where it is to drain it, but obviously that man's is going to go in cardiac arrest. So you have to do it quickly, which is why he did. Basically, JD did decompression of the chest, and he put a chest drain in, and they suction out all the blood. That's basically what he did. And Dr. Cox, that is how you support a junior doctor. JD did very well. But yeah, hemothorax. I've seen many of those. And pneumothorax, that's where air gets trapped into the chest wall. But yeah, JD did very well. And kind of say, if I ever saw a doctor do that with their gloves, and hopefully he better put those in the bin. Because if he did that on my shift, and I found those on the floor, he'd be a dead man. But no, well done, JD. That must have been a very terrifying thing to do, but good on him. Good on him. Now, after this man, he would have had to go for a chest x-ray to make sure they've drained off all the chest, probably an ultrasound or a CT scan as well. He's a trauma patient, so definitely would have had to go for a CT scan. But yeah, I just love this show so much. It's just great. So, what do you think of Scrubs? Are there any more episodes you specifically want me to cover? Are there any more TV shows you want me to react to? I love House, so I definitely plan to do House. And definitely do more Scrub episodes as well. But yeah, let me know. Just let me know down in the comments. And thank you so much for your support. I appreciate everyone who watches my videos. Let me know down in the comments what you thought of this video. And yeah, please subscribe to my channel. Thank you very much, and I hope you have a wonderful day. Bye!